So carboxytherapy has actually been around for a really long time. What it originally started as is we know in the body, CO2 is a natural vasodilator. Unless you're in the lungs and then it's a vasoconstrictor and it causes pulmonary hypertension and it's kind of a nightmare. But everywhere else in the body, what happens is if you have any type of tissue damage and the pH becomes more acidic, carbonic acid will turn the pH to be more acidic. It will vasodilate to try and bring oxygen and nutrients to the area. So CO2, I don't know, like 70 years ago, it was first trialed as doing like these little tiny micro punctures, these little tiny injections into soft tissue to try and stimulate blood flow and to try and stimulate rejuvenation. But who wants to have a bunch of pokes to their face and pokes to their body to like infuse carbon dioxide? So Lana and Lumisk came up with this proprietary blend of this mask that can permeate skin cells with CO2. So CO2 permeates through the tissues and down into the cellular level. And what that does is it changes that tissue area to have more of an acidic level. So if we remember way back from biochemistry, something called the Bohr effect. So the oxy-deoxy hemoglobin curve. So in acidic levels where the pH is decreased, the curve shifts so that it unloads more oxygen. And what is oxygen? Oxygen is really important for rejuvenation. It allows the blood vessels to actually vasodilate and bring in more blood flow, more nutrients into this area to kind of wash out all of the bad humors, for instance, that we've just created by doing some type of trauma to an area. And so carboxy therapy, the CO2Lift mask, is amazing that we can provide this with no discomfort to our patients. And we can actually send our patients out feeling better than when they came in. So it makes complete sense that any type of a trauma that you're doing to the skin, it makes those skin cells, the desmosomes between the skin cells, leaky so that this product penetrates through and allows this additional healing and allows the bad humors to be flushed away. Similarly, when you put this product on a mucous membrane, we know that if you apply any type of medication to a mucous membrane, it's readily absorbed into the body. So even though we're not really talking about vaginal rejuvenation with this topic today, it makes complete sense that placed inside the vagina, that's a mucous membrane. And so it's readily permeable to receiving the carbon dioxide, turn into carbonic acid, change the pH, change the oxygen dissociation curve so that oxygen is delivered more readily to the tissues and causing vasodilatation to wipe out all of the bad humors and lactic acid and trauma that you've caused to that area and promote healing. So in essence, that is how CO2Lift works, with all the pluses, all the benefits, with none of the discomfort.